Sutherland, joining you from the NHAA 2023 Naturopathic Symposium. Here with us today is Dr. Brad Leech, who's been presenting on a fascinating topic. Brad, can you tell us a little bit about what your presentation was around?
Sure. It was a very controversial topic on the use of antimicrobial herbs and the impact that they may have on causing further functional dysbiosis in our patients. I believe the audience really resonated with what I was saying, and what I'm hearing talking to everyone in the room is they've had this thought for many years that high dose antimicrobials may be causing problems, but they just weren't sure. And so I presented some very compelling research that used metagenomic sequencing to measure the whole microbiome. And what the research showed was taking berberine supplementation around that 500 milligrams twice a day for 12 weeks resulted in an increase in disease-associated species, an increase in hexa-LPS producing species, a decrease in health-associated species, and a decrease in butyrate producing species. This is not what we want, especially when it comes around to inflammation within the gut. And what I ended the talk on was my 4 rules for using and considering antimicrobial use, which is test, reflect, protect, regenerate. What I mean by that is testing the microbiome, understanding the function, the diversity, the species, the environment within the gut. And then the second rule is to consider the patient, consider their overall health, and consider their microbiome. Is there an actual pathogen you're trying to kill? The third rule is to protect the microbiome. So make sure that the patient's consuming a lot of prebiotic fibers in their diet if they were to use antimicrobials. And the fourth rule is to regenerate the microbiome. So using fermented foods, diversity in the diet, and these core naturopathic philosophies to support with inflammation, motility, gut integrity, and the mucin layer within the gut.
Absolutely fascinating. What I love is that you're bringing a new perspective of thinking to how we have been conceptualizing antimicrobials. And I know in my clinical practice, a lot of patients are taking berberine because they think it's good for their blood sugar levels. So we have a lot of people probably taking a lot of antimicrobial herbs.
And I gave the analogy of berberine and metabolic health. There's no denying that there's a lot of research around berberine and metabolic health. But what we know is only about 0.3% of berberine is actually absorbed in the small intestines. Thereby, the vast majority of it is going into the large intestines and causing a dysbiotic reaction. I give the analogy that, yes, berberine is great for metabolic health, but so is statins. And it's that concept of our naturopathic philosophy of first do no harm. There are so many other interventions that we could utilize in clinical practice, such as chromium, zinc, bitter melon, which can support with metabolic health without causing further dysbiosis.
Yeah, all amazing points. Thank you so much for joining us today. I've really enjoyed this conversation. If you want to hear more of Brad's wisdom, head to his podcast that he did with our ambassador, Lisa, for more information.